Good morning, Miley. I'm Christina. I'm going to be your nurse today. We're going to be checking out your peripheral vascular system in your belly, okay? So I'm going to check your pulses. And have you had any problems? Anything you're concerned about? Anything that changed?
No.
Okay. All right. I'm going to feel your carotid. One side. Good. All right. Fabians. Okay. Feel your temporals. All right. And we're checking your brachials. All right. And lastly, radial. And we're going to check your pulse. All right. So you have a regular rate of 82 with a regular rhythm. This is our 2+. Alright, check your popliteals, and then your posterior tibials, and then our dorsalis pedis. Okay, and then we're going to go back and check 3 of them just to make sure that we don't have any bruits. First, we're going to listen to your temporals, both sides, and then your carotids in 3 places. 2, 3. All right, both sides. And then we're going to listen to your subclavian. And both sides. All right, so no bruise on the carotid or on the subclavian, and then we didn't have any sounds when we checked your temporal. Okay, and then I can tell that your skin is warm and dry, and there is no clubbing of your fingernails. I'm have you put your fingernails like this. This is to check your profile sign. Good, 160 degrees, and there's no edema, and we can see a few veins, but I don't see any varicosities or anything like that. Her legs look good, no lesions or anything. I don't have any concerns about her vascularity. I'm going to go ahead and have you lie down. I'm going to measure this little vein on your neck, okay? We couldn't see it when you're sitting up straight, which is a good thing. That's normal. But we're going to go ahead and measure. Have a little estimation of your CVP. All right. I'm going to go from here and measure where we see it. It's really barely okay. We're at 1 centimeter, which when added to 4 to 5 would put you in normal range, my dear. All right, go ahead and scoot back for me. And I think we're all done with that part. The next part is your belly. Have you had any pain or anything bothering you with your belly, my dear?
No.
Nope. Okay. All right. We'll have you lay down completely flat for me. And I'm first going to look at your belly. I'm going to be pressing and listening, okay? All right. So everything looks good. It's smooth, it's flat, she doesn't have any masses or anything like that I can tell. It looks very normal. I'm going to listen, okay? All 4 quadrants, and then I'm going to be listening at your vessels that go through your belly. Just breathe normally, okay? Okay, normal active bowel sounds, and then listening for any bruise in her vascular. Okay, good, no bruise. Also, I noticed that she has very normal movement for her age with her belly and her breathing. I don't see any pulsations of her aorta except for when she sucks her belly all the way in. going to percuss the whole abdomen, all 4 quadrants. And very normal for someone. Very normal with someone who's tiny like this. Mostly all tympanic sounds except for the area where your liver and your spleen are, so that is good. And not over your bladder, so you must have been pee lately. Okay, so the next thing I'm going to do is I'm going to be pressing, okay? So you let me know if anything hurts. And we start with light palpation, and then we move to deeper palpation. I don't feel any lumps or masses. She's not tender. Lean your head back so your belly relaxes. Good, there we go. Thank you so much for being so patient. All right, nothing hurting, right?
No.
Well, that's good. We're going to go one more time. We're going to go deeper. And with the deeper palpation, I still don't feel anything. All right, and then I'm going to go back and we needed to percuss your liver. I would have done this before I started palpating. I just forgot. All right, and we're going to mark this with my marker and see how much farther we have to go up before we get dull. And then we measure the distance from where we had tympanic sounds and where it got dull, so that we can measure. Okay, good. Okay. Her liver span is 4 inches, so that's normal. And then we're just going to palpate your liver. And we can feel a sharp edge that's movable. And then palpating your spleen. Okay, that's good. And soft. That's okay. We're doing kidneys. You can feel the tip top of her left kidney. And on her right kidney, you can feel just about the first half of it, and it's round and soft. And then lastly, we're just measuring her aorta palpation to make sure we don't have any aneurysm or anything like that. And that is within normal limits. It's only about 1.5 centimeters probably estimated. And the last thing we need to do is have you sit up on the side of the bed, and we're going to check your costovertebral angle. Make sure there's no tenderness back here, so you just let me know if this hurts, okay? Any pain?
No.
Good. Okay.
Hello, Paul. This is Claire.
Any pain there?
No.
Okay. All right, Miley. Well, I think we're all done. Thank you so much, okay?